Okay, this video is, are pink ribbons a joke? You know, you see the women with the pink ribbon for breast cancer, and you're supposed to think, oh, isn't that nice? She's raising money for breast cancer. I'll tell you what I think. I think she's stupid. Okay, I'll tell you what I'm saying that. Why do I say that? Who gets the money when you raise money for breast cancer? I don't know for sure, but I'll bet you it goes to some chemo company, all right? I see pink ribbons all over the place, and I know people mean well. I know women mean well. I know a lot of times they've lost a friend. I got a friend whose wife just died from breast cancer, okay, from side effects of chemotherapy. And what I'm saying here is it's always breast cancer awareness or some other cancer awareness or something. How come I never hear we're going to teach these women how to prevent breast cancer? We're going to empower these women how to prevent breast cancer. How come whenever I teach medical students and doctors, they never know anything about breast cancer? Okay, I can tell you, I have a lady doctor friend who has another lady doctor friend, and she introduced me to her lady friend who was a big shot OB-GYN doctor, and she had like 2 other degrees in something else. And it was a little bit of, I'll bet you she knows more than you do about estrogen or something. And it was a little bit, I get these competitive little things. So just for fun, I started asking this lady questions, the big shot OB-GYN doctor. She, of course, knows birth control pills. I don't know that much about birth control pills. I don't care about birth control pills. But when I started going through estrogenic chemistry and risk for breast cancer, she knew very, very little. Okay, I can tell you, another lady, sort of a big shot in the medical community, very beautiful lady. This lady was a super fox in terms of physical beauty. She's an MD, PhD. Her friends all think of her as like the queen of their little social clique of doctors, okay? But the reality is she's really jealous of me. And, she was like, you wouldn't even proofread my book. She's so jealous of me. She just can't handle it that I'm a lot smarter than her. So anyways, just to let you know, this is what happened. So she got breast cancer, and I offered to help, and she kind of had this stuck-up attitude. She's in a field, I'm not even going to say her field, but it's more close to what you'd expect for somebody to know about breast cancer. But the reality is I know tons more than she does. I offered to help her. I wanted to help her. She didn't want to talk to me. She sort of thought it was beneath her to speak to me. She kind of has a little bit of an attitude that if she had grown up in the United States like me, she could have gone to Harvard, and I'm not that smart, and I don't really know her field so well. But it's all childish silliness. But what's sad about it is I know a lot about breast cancer. I could have really helped her. She refused to speak to me. And then I'll tell you what else happened. She had terrible complications from chemotherapy, and she died at a young age, okay? At quite a young age. It was a devastating thing for her family and for her friends, all right? All right, well, I just tell you about this because this is stuff I see all the time. When it comes to breast cancer, 99.9% of doctors are total ignoramuses, okay? Dr. McDougall has a very good lecture on breast cancer, but I'm going to tell you, I think my lectures on breast cancer are better than his because I not only tell you about a little bit about breast cancer. He does a great job of going through all the conventional stuff, what to watch out for, get a lumpectomy instead of a mastectomy, etc. But I'm telling you how to prevent the darn disease. About the risk of aluminum in your armpit from the deodorants. It goes into your pores. It gets transdermally absorbed. It's a metalloestrogen. It stimulates proliferation of the breast ductal cells. Okay, about the estrogenic preservatives in deodorant like parabenzoic acids, transdermally absorbed. Then they go through the shared lymphatics to the breast, stimulate proliferation of breast ductal cells. Philippa Dabra did a lot of the research on this. You could read her book. You can read the book by Anthony J. about estrogeneration, all about estrogenic chemistry and the increased risk in breast cancer, plus tons of other estrogenic issues. And you look at all these personal care products, they all got estrogenic preservatives in them. How is estrogens are excreted from the body? Okay, the liver conjugates them and it releases them into the bile. There's 2 main types of gut bacterial flora. There is the bacterial flora from eating meat and processed food, which are low fiber diets, and that's the bad gut bacteria. They have more of an enzyme called glucuronidase. Well, what happens is the liver, when the body excretes excessive estrogen, it releases it into the bile. The bile passes out of the liver through the bile duct, goes into the small bowel, and then we defecate it out of our bodies to get rid of the excess estrogen. Well, the estrogen in the liver is conjugated with glucuronic acid. That's a chemical that's polar to make it more soluble in the bile, more water-like, if you will. So what happens is the bad gut bacteria have more of an enzyme called glucuronidase. They deconjugate the excreted estrogen, and that removes the glucuronic acid. Now that estrogen gets reabsorbed into the body. So it raises blood estrogen levels. Women who eat meat and processed food diets have the bad gut flora type of bacteria, the bad gut microbiome. You only need to know 2 types. There's good and bad, okay? Good comes from eating plant foods because of the fiber. Bad comes from the processed food because of the lack of fiber. All right, so anyways, they have higher estrogen levels, meaning they get more fibroids in their uterus, meaning that they get more fibrocystic disease in their breast, meaning that they get more breast cancer. The other thing is, no one teaches these women, gee, you know, your tap water almost always has aluminum as a clarifier plus tons of estrogenic chemicals in it, and you need a carbon filter to remove those estrogenic chemicals. So basically, I use a reverse osmosis in the kitchen to remove just about everything. So basically, nobody educates these poor women. Okay, so how is the daughter of a mother who died of breast cancer any better off if she doesn't know this stuff? So awareness is just a way to say, go get a mammogram so, you know, we can turn you into a patient and sell you more chemotherapy. That doesn't really help the patient very much. So I mean the women well, and I was a little mean of me to say they're stupid at the beginning. I was exaggerating for an effect, okay? I don't think they're stupid. I just feel sorry for them. And don't get me wrong, men are not much better with prostate cancer, okay? They still, how often do you ever hear a guy who knows anything about the Ornish study or any of this other stuff about, you know, what causes cancer? For any disease, that's what you want to know. What causes the disease? How can I avoid those things? And then also, you don't tell the women about exercise. When you exercise, you increase lymphatic flow. Your arteries are connected to the heart, and so are the veins, so there's a pump to push the blood flow along. However, the lymphatic vessels, which contain the immune cells, that has no heart. The immune flow in the lymphatic system, a parallel channel of vessels for the immune system to travel in, runs parallel to the blood vessels. That is moved along by exercise. You can increase the amount of lymphatic flow about 10 to 30 fold by exercising. So that helps your immune system to surveil the body and remove metastatic cells. Even like a 1 centimeter diameter tumor will shed over 1 million cancer cells into the blood every day. What do you think removes that? Your immune system. So you want good immune system circulation, your white blood cells, okay? So what I'm saying is, if you really want to help a woman and she wants to lower her risk of breast cancer, she should learn about this estrogen chemistry. I just summarized it in 10 minutes, 5 minutes. How long did that take? It's pretty easy to learn. There's a little more to it, but not much more than what I just talked about. I got a bunch of videos about it. So anyways, don't focus on breast cancer awareness. And, you know, I'm not even sure mammograms are a good idea. Look up the data, Peter Gotsky from the Cleveland on the Cochrane collaboration. McDougall also has good lectures on what he thinks about screening, and you'll be amazed at how overrated it is, mammography, especially in younger women when they got the dense breast and stuff. And when I was a resident, I used to hate mammography rotation. It was my least favorite thing when I did a residency. I was at a big hospital where they did tons of them, like about 80 to 100 of them a day, patients coming through there, and all these women were crying, thinking when they were called back to get checked for their breast, thinking they have breast cancer. And you know, I'm semi-autistic. I'm the last guy in the world you'll want talking to a crying female who thinks she might have cancer and she's really got nothing. So I knew that was, and they look like, you know, a map of the moon looking at a mammogram. It's so intellectually boring. You're just looking for calcifications or a focal scar, which you really can't see too well in a dense breast. So it's not very intellectually satisfying. The reason doctors go into it is because it's easy in terms of you got good hours, you can go home early. There's no after hours mammography emergencies. But anyways, the whole point of this talk was, instead of teaching women, you know, they need to get a mammogram, which is probably not even true. What they need, in most cases, not always, sometimes there's very good reasons for it, if there's an obvious palpable mass, etc. But, you know, teaching them, empowering them to learn how to minimize their risk.